Hello once again friends, and today we will be discussing another new module and we will be discussing pressure source. And I am Dr. Abhijit Dam and I am the President of the National Association of Palliative Care for Ayush and Integrative Medicine. Well, pressure sores are a big issue, especially when caring for the terminally ill patients and also for patients who are so weak and who are bedridden for a long period of time. So, pressure sores by definition are localized area of tissue death and is the result of impairment of vascular and lymphatic system of the skin and tissues caused by three types of forces. First is compression. If there is a constant compression in one area, so the blood supply to that area is hampered. If blood supply is hampered, then oxygen and other nutrients will not reach that area and there is a breakdown of the skin over that area and you have a pressure sore. So, either by compression, second is by tension. If there is a constant tension out here, a constant pull or push type of force out here, or shear type of forces, that is when one surface of the skin remains constant and the other I pull it. So, this is a shear type of force. So, these three type of forces usually contribute to development of pressure sores. So, basically constant pressure over a long time, if it is there is a collapse of the underlying blood vessels. So, if there is a collapse of underlying blood vessels, there is no nutrition, oxygen, tissue perfusion is hampered. So, there will be tissue hypoxia and ischemia and breakdown of the skin, overlying skin, and bed sores are developed. So, basically what we have to consider is not the normal blood pressure, but the capillary pressure. The pressure at the capillary level is around 28 to 30 millimeters of mercury. So, if the pressure on the skin is maintained for more than 30 millimeter of mercury for a prolonged period of time, you are prone to tissue ischemia and bed sore development or pressure sore development, right. So, here is an example of this is an extreme example of a pressure sore, and this is what we call a grade 4 pressure sore, because here what you can see is the sacrum. This is the tailbone or the sacrum, and you can see a yellowish slough which is present, and this yellowish slough which is covering the bone. So, this is a grade 4 pressure sore and you can actually see the pus also coming down. So, this pressure sore has now become infected also. So, whenever there is an infection of a pressure sore, the pressure sore further grows up very rapidly. It increases in size, there is more pain, there is inflammation, it gets worse, and then there is malodor and so on and so forth. There are many contributory factors to development of a pressure sore, some of which are intrinsic, that means which cannot be changed, like age, extremes of age, presence of neurological diseases like strokes and say leprosy, classical example, vascular diseases where there is poor vascular supply, poor nutritional status, extrinsic factors like pressure, shear forces, friction, moisture especially in the groin area where there is a constant moisture, immobility, patient is not being able to move, and presence of pathogenic organisms, again which is present in the mouth area or in the groin area. So, the high risk groups are bedridden, obese, very thin and emaciated, diabetics, incontinence where there is incontinence of urine or motion because the area becomes wet and full of pathogenic organisms, excessive sweating or exudates, hyperpyrexia, malnourished patients. So, these are again at a increased risk for development of bed sores. So, what are the commonly afflicted areas? Imagine yourself lying straight, supine like this. So, what are the pressure points? Your occiput, your elbows, your shoulder blades, your hips, the acetabulum, that way. If you are lying by your side, where in your ear pinna, right, your shoulder or acromion process and so on and so forth. Now, here although this picture is not very clear, you can clearly see that this patient was lying on his side for a prolonged period of time, and you can see the bed sores right here, see how many bed sores he has, and not only here where this leg was touching on this leg, here also you have all the contact areas there were bed sores or pressure sores. Bed sores is a loosely used term, the right term is pressure sores. So, there are various stages of damage, and the classification of pressure sores is from grade 1 to grade 4, right. In the early stages, what you can find is erythema, area of redness. When you are doing back care for the patient, you can see an area of redness which is non-blanching or blanching in the early stages. So, that area of redness should be focused upon, because that is one of the earliest sign of development of a pressure sore, and once you give early attention, then you can prevent the pressure sore. So, what are the preventive measures? Because prevention is always better out here. Maintenance of skin integrity, that means good hydration, good nutrition, daily examination of skin integrity and pressure points, look out for area of redness. Pressure relief techniques, that means every 2 hours you need to slightly change the posture of the patient, and if you can't do so, use the bubble or ripple mattresses or use a water mattress, right. But best is to constantly keep changing the pressure position of the patient even slightly every 2 hourly. Promote patient movement, promote spontaneous movement if possible, nutrition and hydration, education of the patient and family members. You need to tell them about bed sores and how it is generated and how best you can do to prevent it, and minimize external factors like moisture, cleaning up the urine and feces, using dry clothes, using clean clothings. Remove the source of irritation, remove necrotic tissue, infection control, teamwork is very important. Again, the same principles here would apply as you do dressings in a malignant wound. So, you need to look up the module on management of the malignant wound as well. The same principles would apply here too, that is giving an extra dose of analgesic half an hour before, ask the patient to take a good bath before you go for the dressings, prepare normal saline at home, or if you can afford it, get it from outside, clean gauge pieces, sterile gauge pieces, clean the whole area, give attention to the surrounding skin, do a proper dressing, avoid maggot infestation. If there is a large sore, large pressure sore, nurse the patient inside a mosquito net, so that the flies do not sit on it. So, irrigation with warm normal saline, do not use cold normal saline, use warm normal saline, remove exudates, right, and then good nutrition and so on and so forth. The principles remain the same basically. And here you can see we managed to inspire the local community boys, the boys of the local basti, the same slum. They used to take care of this elderly man, they used to bring him out of the hut, sit him out on the sunshine. Now, sunshine is a brilliant way to tackle so many things, because the sun rays themselves have certain bacteriostatic and virucidal effects. So, nursing care in the sunshine, once you take a person out of a dark room, it improves the psychological well-being also. You can see mother nature is a big healer, right, and daily dressings, talking to the person, good nutrition, so on and so forth. What, as I said, what is of essence is you need to have a compassionate heart, and that is the greatest qualification that a good palliative care practitioner can have. Well, that is about it, and this was about pressure sores, and I hope that I have managed to give you a broad outline about the management of pressure sores, and thank you.